So we're doing a periodontal surgery setup. So first thing you want to do is check the sheet for things that are not marked, such as this one. So usually we don't put this in a box and we only get it on the day. So I have to make sure this one is taken out from the stereo box and open it. So as you can see, there's already open EMS there, so I will just mark it as yes. And we have to get the pref gel as well. So pref gel usually is in the fridge. So fridge is over here. So we just want to look for a box that says pref gel, which is right there. And we just want to get one like that, and then mark the sheet. And then we want to get region pause as well, which is already marked there. I think that's going to be inside the box already. I think that's pretty much it. Saline. Just pause with this one. So what we have here is the prayer box. So this is the prayer box. So in prayer box there's things that are a checklist as well. You just gotta make sure everything is in there.
So these all things should be in the bigger box.
So we've got sterile ground, post-ops, and we've got the region faucet over here as well. So you just want to get everything out first, just so you know you have everything. So we've got 6 and 5 all dialogue. We've got the post-ops, and then we've got the dap and dish and micro brush. And we've also got X-ray and the monojets. Okay. Now what you want to do is you want to get a bib. Get this place here. Okay. And then you just want to arrange all the things first. So we've got prep gel, region bar, sutures, and then dap and dish, monojets, and the gown. And then post-ops with the sterile gauze. We've got the gauzes here. And the X-rays. And the LA. You just get a paper towel and put it here. And then you get the saline here. So this is saline. And you get the holder, you get one cups, and then you just fill it with saline. About this much. Okay. Just put your things here. Put this option here. So, high-speed suction, saliva ejector on the right, and then microsuction on the left. And then EMS tips. So we always start with long tip. Okay. Here, attach them together. This one here, and then attach the X-ray. So you've got 2.5, so I just set up for 2.5. After you've set up the holder, you have to set up the software. So first step is you have to read the patient. So just left click and then left click on read patient. So this one. And you have to go here in the tooth symbol. It says X-ray. Click that one. This one, Dimaxis. And just wait. Okay, once you see this icon pops up, it will open the X-ray, and then what you want to do is check the name if it's correct, and go to the imaging, intraoral exposure, and then just click the tooth number you want to take X-ray. Okay, and then here. Alright, as you can see, we've already set up the 15C and 12. Then from there, usually it comes with like this, and then just have to attach them together, and that's it.